My journey has been one of trying to find out what the latest is in science so that I can use it for me personally, but I also have this commitment to the men in my support group. I want them to be empowered, educated, smart patients who can go out there and get the very best that there is available to them. But the only way we can get new treatments is to participate in clinical trials. When I was 50 years old, feeling very strong and healthy and in the prime of life, I had to get a physical exam. And I took my mighty mole wife with me, and she told the doctor, he hasn't had a physical in a long time, and you make sure that you check his blood sugar and his cholesterol and everything else like this. And the doc said, well, there's a new test, 1989, that just come out called the PSA, a prostate-specific antigen. And so they drew the blood, and next thing I know, I get a call, and he said, geez, he said, your PSA is 39. We probably, you might want to talk to your urologist because I'm not sure what this means. So then they did the digital exam and found a firmness in my prostate gland, and came out that I had prostate cancer. If I hadn't had that PSA test and I had gone on like I always had, I wouldn't be here. I wouldn't be here to see my grandkids, my great-grandkids. I wouldn't be here to extend my hand to help others as much as I try to do. So that whole idea of getting screened, knowing whether or not you have cancer, is really, really important. And the best part of it is if you go get a PSA test and there is no elevated PSA, you get this nice feeling of, wow, it's okay, things are all right. And you should be able to get a PSA with that in mind. You're going to be okay. With a PSA of 39, and I did have extracapular extension. I had surgery, and they found out that the cancer had extended beyond my gland, which meant it had spread through my body. So after surgery, my PSA never went to undetectable. And the next standard of care, the next question was, do you want to have radiation? So I opted for 35 sessions of external beam radiation, and they radiated the prostate bed, hoping that some of those cancer cells were still within that prostate bed and would therefore get radiated. After about a year, and my PSA still hadn't gone down that far, my wife and I were talking to our urologist, who said, Jim, you failed the two major treatments for prostate cancer, surgery and radiation, and you probably have 1 to 3 years to live, and you might want to go home and get your life in order. That was in 1990. This is 2012, and I still don't have my life in order, and I don't intend to. 2007, when Abbott Laboratories was applying for a new drug that was for men with advanced prostate cancer. At that public hearing, Mark Moyad from the University of Michigan stood up and said, my father's been a urologist, I'm a urologist, and there's only been one drug approved in the last 45 years that has survival benefit for men with advanced prostate cancer, and that's chemotherapy. When I heard that, I realized that the only way you get a drug approved through the FDA is to have the clearly defined clinical trials. And as I thought about my participation in a clinical trial, I realized that there is a hereditary predisposition with prostate cancer. And I wanted to make sure that my sons, my grandsons, and now my great-grandsons don't have to go through this same anguish that I've gone through dealing with prostate cancer. The second time I looked at a clinical trial, it was with MDV 3100, and it was because my PSA was going up. I was androgen independent, or castrate resistant, or we used to call it hormone resistant. I've had this darn disease so long they've changed the name of it 3 times. And it was, again, taking the risk. Am I going to get a placebo or am I going to get the real drug? On my clinical study with MD for 3100, in December 5th, my PSA was 30. In January, it went down to 9.9, and it has gone down every month. And my last PSA, it was 4.3. So my Dr. Higano said, well, Jim, I think you might be getting the real drug or one darn good placebo. Exercise is not just good for my prostate cancer, but it's good for my heart, my blood pressure, my blood sugar, everything. And when I get done with my workout, my shirt is wringing wet. I know I can feel these endorphins running through my body going, I'm here to help you. If I see anything that needs to be fixed and repaired, here's my endorphins coming out to help me that way. One other lesson I learned in life and dealing with prostate cancer comes from my background in athletics when I used to do some coaching. Practice doesn't make perfect. Perfect practice makes perfect. Perfect visualization of yourself in any sport is so much better than just going out and hitting the ball. Seeing yourself successfully doing what it is you have as a goal or a vision. And not only visualizing the picture in your mind, but tasting it, feeling it, smelling it, getting every sense in your body committed to what it is you want to have. And my vision is this healthy, whole body. And in all the spiritual things I know, we understand that we have within us the power to heal ourselves. During my visioning process, when I get on my treadmill, I close my eyes. I have to hang on, but I close my eyes, and I use a prayer that's been very common in our faith, and that's called the prayer for protection. And the prayer goes something like this. It says, the healing light of God surrounds me. The light of God enfolds me. The presence of God watches over me. Wherever I am, God is, and all is well. I envision this halo of God's healing light coming down from my head, running through, around, and in every cell in my body, awakening the immune cells, showing them the way to destroy those cancer cells that are in my body, making them healthy and whole. Now we all know that there's more than one name for God, and whatever your name for God is, that's that power that's bigger and greater than any one of us. And that's the power that we use to help us spiritually, mentally, and physically. This is my support group. This is where all the love comes from and all the support comes from. So no matter what's going on in your life, you can always depend on unconditional love from these two.
It really is a journey for the family, particularly for the spouse. You often feel helpless, like there's really nothing you can do but to be there. But with Jim's attitude and Jim's enthusiasm and his just his ability to give to so many people, I think that's part of his healing process. There's not a day goes by that we don't get a call from somebody somewhere in this country, and he spends time with them, and he travels a lot. And I strongly believe that, along with his own positive attitude, has a powerful effect on his healing process. The thing I've been very impressed with Jim and John and some of the other people in the support group is their ability, number one, to learn how to keep track of things so that they don't rely on their wives to keep track of what they get when and their dosage of medicine and take your medicine, that they empower themselves to do that, and that they don't give up. That they look to each other to see what's going on, and they're very supportive of one another. It's pretty impressive, and I'm very proud of both of them.